Hello, everyone. I'm Roxana, and today I'm excited to be joined by Tamzyn Murphy, a registered dietitian, science writer, and nutrition educator. Tamzyn has a special focus on ketogenic diets and therapeutic carbohydrate restriction, particularly for mental and gut health. With a master's degree in physiology under Professor Tim Noakes and her role at Nutrition Network, she's been a leader in this field, helping educate healthcare professionals around the world. Tamzyn, it's great to have you here. Thank you for joining me today.
Oh, it's wonderful to be here, Roxana. Thank you for having me.
Awesome. So let's hop right into a topic I know you're really passionate about, using ketogenic diets for mental health in children, particularly conditions like anxiety, OCD, and ASD. Why is it that a ketogenic diet has such an impact on brain function? I'm thinking about metabolic disruptions that are associated with these conditions.
Yeah, that's a really good question. A ketogenic diet works across all the metabolic aberrations that are present in pretty much all mental health conditions. So you can kind of summarize the metabolic aberrations, or if you will, or metabolic dysfunctions that are present in mental health conditions as 6. Okay, so I'm just going to list them, and then we'll go into them a little bit so that you can understand how a ketogenic diet impacts each of them. And then we can start to understand why a ketogenic diet might actually help with so many mental health conditions. So basically, pretty much all mental health conditions that I can think of, whether that's anxiety, OCD, which is a form of anxiety or presentation of anxiety, whether that's schizophrenia, bipolar, depression, or even neurological conditions such as Alzheimer's or neurodevelopmental conditions such as autistic spectrum disorder, also known as ASD. They all have these things in common. 1, they have insulin resistance and cerebral glucose hypometabolism. Now, this sounds like, two big kind of complex words, but basically in these conditions, the neurons in the brain that are required for thinking and feeling and all those things that are involved in mental health, they can't process glucose properly. And there's a level,
Why is that?
often a level of insulin resistance. So we don't know exactly why. But we think that it might be linked to mitochondrial dysfunction potentially, or due to insulin resistance caused by, at the level of the blood-brain barrier, caused by basically our modern lifestyle and diet. So the neurons aren't getting the glucose that they normally run on. And in other words, the neurons start to have some kind of fuel shortage. And when neurons have a fuel shortage, obviously they're not going to be functioning properly. In the case of Alzheimer's, you can actually see the neurons shrink. And so this is the case to some degree, in some form, across pretty much all mental health conditions that I know of. Now, the second one, so that was insulin resistance or cerebral glucose hypometabolism. In other words, insufficient fuel for neurons. Okay. The next metabolic aberration that occurs across pretty much all mental health conditions is inflammation. Now, inflammation causes the release of pro-inflammatory cytokines, which then impact on a whole lot of these problems that I'm talking about today. So, for example, inflammation can cause the release of these cytokines, which then can impact on your neurotransmission. So actually, cytokines have been shown to impact on the ratio of your calming neurotransmitter GABA to your excitatory or stimulatory neurotransmitter known as glutamate. So inflammation directly impacts on how calm or how excited or anxious your brain is. It also affects the monoamines, which are known as, you might know them better as serotonin or noradrenaline or norepinephrine. These are really important in there, and also dopamine. These are directed. Well, the wow, my words. Basically, the way medications affect mental illness is thought to be through these neurotransmitters. So they modulated. That was the word I was looking for. They're modulated by the medications, right? Now, inflammation modulates these neurotransmitters as well. So, you think of serotonin and noradrenaline being being dysfunctional in autism, but you also see those neurotransmitters being dysfunctional in all sorts of mental health conditions, whether that is anxiety or depression as well. So inflammation is a problem. So we've spoken about cerebral glucose hypometabolism, we've talked about inflammation, and now we've even talked about neurotransmission. And that is not just a neurotransmitter problem. You can see that it is also a metabolic problem because it's caused by inflammation, which is a metabolic problem. But also, interestingly, we keep touching on mitochondria, which I haven't officially touched on yet, but they also impact on neurotransmitters. Many neurotransmitters their formation starts and their signaling ends within the mitochondria. So I may as well touch on the mitochondria then as the fourth one. So
So
mitochondria
the
are
mitochondria is
dysfunctional.
the powerhouse of the cell. They turn
Exactly.
chemical energy in the food into energy that can be used, ATP, by the body. And they need to
Exactly.
perform at peak performance.
Yes. And they need to be at peak performance in all the cells of the body, but how much more so in the brain, right? Because the brain
Right.
uses, even though it basically weighs very little compared to the rest of our body, it uses 20% of the energy that is used by our body is used by our brain. So it needs those mitochondria really badly. And if the mitochondria aren't making enough energy, if they're dysfunctional, then, this becomes a huge problem, which is also why it's been linked to the cerebral glucose hypermetabolism, or the inability of neurons to use fuel properly. But also these neurons aren't getting enough energy, right? So if the mitochondria aren't functioning properly, then they're not making enough energy. No wonder our neurons are starving in these mental health conditions, in these neurodevelopmental conditions, in these neurological conditions, right? So mitochondria are a big problem. You don't want to have them faulty because then your brain is going to be faulty. If it can't get the energy, to do what it has to do, it's not going to work properly, right? It's like a car that doesn't have enough petrol, or gas. It's going to be a problem. Or electricity.
It's not the solution to increase serotonin or all these chemicals when the pathway doesn't work.
Exactly. And what
when
if
the energy is missing?
Exactly. And what if that powerhouse also happens to be responsible in part for the neurotransmitters? So you think, oh, well, let's just give a medication that increases serotonin, like a serotonin reuptake inhibitor used to treat depression or anxiety. But then in many, many people, it doesn't work. And you wonder, is that because maybe the mitochondria that are involved in the signaling of that serotonin, or the receptors of many of the neurotransmitters, could it be because or at least partially be because it's malfunctioning, because the mitochondria are malfunctioning? And then if you think that it is, and many people like Dr. Chris Palmer, Georgia Ede point out that if it was just a neurotransmitter problem, these mental health conditions, like let's say anxiety or depression, right? Then if you gave someone an antidepressant for depression, it should always work. If the neurotransmitters, it doesn't. And besides, when it does work, it works 6 weeks later, but the neurotransmitters levels improve within a day. So if the neurotransmitter levels improve within a day, but the depression symptoms only improve within 6 weeks, then is it perhaps that medication's doing something else apart from just raising the neurotransmitter levels to result in improvement in depression 6 weeks later in the people that it does improve? And it appears that it affects some metabolic pathways as well. So could it be because the serotonin or whatever other neurotransmitter is being changed could have a metabolic effect within the mitochondria? And yes, it appears that it does, many neurotransmitters and many hormones, their production starts and their signaling ends in the mitochondria in many cases. And people don't mention this. So now we've been through Roxana, four of the metabolic underpinnings of neurological and mental health conditions, namely cerebral glucose hypometabolism or fuel shortage, inflammation, a mitochondrial dysfunction, and a neurotransmission dysfunction, which we've also linked to mitochondria, but actually mitochondria is linked to all of these. Then I'm moving on to the fifth one. The fifth one is oxidative stress. So that sounds like a very big word, but basically many people might have heard of free radical damage. Free radicals are basically causing a kind of damage called oxidative stress. And oxidative stress, interestingly, where do these free radicals come from? The primary source of free radicals is the mitochondria. other than unless you're swallowing a whole lot of toxins or something, then it might be that. But generally, in day-to-day life, free radicals or reactive oxygen species, as they're better known in scientific circles, or ROS, comes primarily from the mitochondria. So a dysfunctional mitochondria produces more ROS, or more free radicals, and therefore more oxidative stress. And oxidative stress is really, really damaging to the brain. Also, oxidative stress increases inflammation, which was one of the six as well. So you're seeing knock-on effects from one affecting the other. A mitochondrial dysfunction increases oxidative stress. Oxidative stress increases inflammation. Inflammation
It's all
makes
intertwined.
neurotransmitter aberrations. So it's all intertwined. And then the sixth one is the microbiome. Now, the microbiome is very much a metabolic underpinning. We might think, wow, that seems like a little bit of an odd one out. But the truth is, within 3 days of changing your diet, your microbiome changes dramatically. A study by Davids et al., 2016, they put 10 people on either a plant-based diet or an animal-based diet, and then they looked at the microbiome. And they found that within 3 days, the microbiome was completely different from each other across the two groups.
Different in a good way.
Well, different. They just were looking at different. So it wasn't
Okay.
worse. The microbiome wasn't worse in the animal group, even though they thought that it would be in the animal food-based group. They thought it would be worse, but the truth was that the alpha diversity, which is another way of describing the microbial diversity, which is an indicator of health, it was the diversity was the same between the two groups after 3 days. But the makeup of those microbes was different. Neither was a pathological makeup. They were just different. So that's just something to bear in mind, that diet, it just shows how powerfully diet affects microbiome. And we know that many of the benefits thought to be from a ketogenic diet on epilepsy, because we know that ketogenic diet is an incredibly potent anti-epileptic drug, if you will, lifestyle, but it has therapeutic benefits, so it's just as powerful as a drug. And in fact, a ketogenic diet treats epilepsy in children in 80 to 90% of cases of children who the medication has failed. So that's how powerful it is. It can
drug
stop
resistant, yes.
Yeah, exactly. The drug resistant epilepsy. That's what
I can add an anecdote to that.
Yes.
One of my children is diagnosed with epilepsy, and we put him on a ketogenic diet just for a bit because he wanted to try it.
Yeah.
And the doctor said, don't stop it abruptly, because if you stop it, it's like stopping a drug. He can have seizures just from stopping it. So it's that powerful. It is actually that powerful. It's prescription strength.
And Roxana, you said it so beautifully. Thank you, because that's exactly what I'm trying to portray, is that the ketogenic diet is having effects that are therapeutic, that are medicinal, actually. And so while it is called a diet, it is really a metabolic therapy, which is why many people in our space are moving towards calling it a ketogenic metabolic therapy, because diet sounds too soft-core, and actually the effects that it's having are often very therapeutic and medicinal, if you will. So,
but the medication has all the side effects. It interacts, it basically bumps all the other blocks out of place, whereas the ketogenic diet doesn't have these side effects.
That is so true, Roxana. In fact, it has beneficial side effects, such as benefits on, and let me go through these, on inflammation. Yes. Are we surprised? It has an anti-inflammatory benefit. It reduces the oxidative stress caused by the mitochondria as well. So you're having less free radical damage. You're having less inflammation. And remember, those pro-inflammatory cytokines were making your neurotransmitters go all over the place. You're having far too much stressful neurotransmission and far too little calm, happy neurotransmission. Well, a ketogenic diet alters that as well. It's been shown to increase the calming GABA neurotransmitter relative to the stimulatory glutamate neurotransmitter, improving monoamines like serotonin, which makes you feel happy, such as noradrenaline or norepinephrine. So again, it's having therapeutic benefits. People take drugs to get these results, right, in their neurotransmitters. It alters the gut microbiome, and in fact, the alterations in the gut microbiome are thought to have be some of the reasons for those benefits that you're seeing in epileptic people, like your child, Roxana. You would think it's all in some direct effect within the brain, but it appears that much of it is to do with the beneficial changes within the microbiome. But talking about the brain and the neuroendocrine system, a ketogenic diet changes the mTOR pathway, which is associated with seizures and also with anxiety. So unsurprisingly, if seizures, anxiety, these kind of things are going to be benefited by a ketogenic diet by the effect of the mTOR pathway as well. Also, and I didn't mention this, but because the mTOR pathway is generally dysfunctional in most of these conditions, but also the hypothalamic pituitary pathway is generally dysfunctional in these conditions. Now, that is your stress pathway. So in most of these conditions, stress is firing hugely. When you go on a ketogenic diet, what does it do? It calms the HPA axis, or the hypothalamic pituitary pathway, thereby reducing the stress response. So again, it's having an effect there. What does it do to cerebral glucose hypometabolism, or this insufficient fueling of the neurons? Well, a ketogenic diet provides ketones, which provide fuel for the brain, for the neurons. It's an alternative fuel to glucose, and the only alternative fuel. In fact, some people would say that it is the preferential fuel. And it turns out that ketones alone can provide the brain with 80% of its energy needs. And there's been some really
it doesn't
amazing
need insulin to process those ketones.
Exactly. And interestingly, you don't even need to get the remaining 20% of the glucose from your diet. Your body can make it. So
right.
Yeah, so that's also a really good point, right? And then obviously a ketogenic diet affects the mitochondria. It increases mitochondrial biogenesis. So you're making more mitochondria. It changes the dysfunction and improves the dysfunction. So you're getting better functioning mitochondria. And it increases the mitochondrial production of ATP. So you're getting more energy from the mitochondria, thereby reducing the fuel shortage in turn. And interestingly, and this is in line with Dr. Chris Palmer's hypothesis, the brain energy hypothesis, mitochondria affects every single one of the other 5 metabolic underpinnings of mental health conditions. So some people are saying, like Palmer, that mitochondria are the primary ones. Now, I don't think we have enough information to prove that yet, because the other things affect mitochondria too. So it could just be bidirectional relationships both ways. But either way, the mitochondria are really, really important. And the ketogenic
but we know
diet,
it works.
Yeah, exactly. We know that
it's not just, it is a hypothesis in one part, but applied, we know that it works. It's not like a magic bullet. It's like a magic shotgun. It works in all these areas.
Exactly. So whether mitochondria are the primary dysfunction, right? Or whether all 6 of these things are dysfunctional or primary dysfunctions, it doesn't matter, because a ketogenic diet, like you say, it addresses every single one of these underlying causes or underlying contributing factors, and the end result is reduced stress, reduced anxiety, reduced depression, improved cognition, reduced seizures and brain hyperexcitability, improved calm, all these things. So mechanistically, it's really not surprising that now the evidence is coming out to show that in human studies, indeed, a ketogenic diet is curing, or at least significantly reducing the symptoms in these conditions, and sometimes completely curing these conditions or making the symptoms go away, whether those are symptoms of psychosis or in schizophrenia, bipolar, depression, anxiety, whatever those symptoms are. And the studies are now coming out to show that indeed these mechanisms, or the hypothesis underlying this, is sound, because the human studies are showing that it's working for these mental health conditions.
I'm convinced it does. There's so many anecdotes, and the multitude of anecdotes is data. So there's so many success stories, including my son. He doesn't have seizures anymore. And he didn't even do it for long, like maybe for a year or so.
My goodness, did he go off it after that?
He went off. I think it was more like a social thing, not being able to eat the same things as his friends ate. And that basically brings us to the next questions. You work with pediatric patients. What are the unique challenges Now, not for those actually with more complex psychiatric problems.
So that's a good question. There are unique challenges with children. I think one of the big ones that we need to consider are that children aren't in control, right? Like their parents are in control, or their teachers are in control, or the host of the birthday party is in control, or their grandparents, or their caregivers, or the aftercare teacher. So this makes it a lot more tricky to do an intervention like this in children. Unless the children are antisocial, not going to birthday parties, not going to school, having no outside factors, and the parents are totally, on board. Now, how many children does this describe? You can't deny a child access to proper education or to social interactions. So trying to deal with these curveballs is really, really, really important. And now it's much easier with something like seizures, like epilepsy, right? Because you can see, the teachers have seen this child, or the grandparents have seen the child seizing. And it's terrifying.
It's not
right?
invisible.
It's
Yes.
not invisible.
It's
But anxiety, depression, these kind of suicidal ideation, intrusive thoughts, delusions, these kind of things are invisible. The child knows they're weird. They know it's not normal, and they hide them from most people. And so grandparents, teachers, caregivers, birthday party hosts, they think, this parent is a little bit insane. They think, well, this parent's an over-controlling, parent who's putting them on this fad diet often. And it's a
fad
problem.
Diet, yes.
Yeah, the fad diet. And it's a real thing. So the first thing as a caregiver is, or as a parent, or as a, one of these people, is to buy into it, to realize that there is evidence behind it. Yes, at the moment, with regards to the mental health, so depression, anxiety, psychoses, and things like this, mainly the evidence is either in epileptic children for this, because they've been studied for the longest time going on this diet.
That's solid evidence, yeah.
It's adults, Otherwise, it's adults. But the fact is that, like you said, Roxana, there are more and more anecdotes coming out, and more case studies, such as the case study I presented at Low Carb San Diego and as a masterclass to Nutrition Network's community. But this child, her anxiety significantly improved. Her OCD significantly improved. And her intrusive thoughts they went from daily to like once a month, once every 2 months. Now, these intrusive thoughts are so terrifying and traumatic to a child. I mean, they're traumatic to an adult, but they are basically thoughts of things that basically are your greatest fears, often, if you will. So if a child or maybe, even as an adult, imagine, what is your greatest fear? That your loved one gets impaled, maybe, by, or cuts their head off as they're riding their bicycle, or that your pets, I don't know, something terrible happens to them, and you're imagining these images and they just pop into your head. Imagine how upsetting that would be if these images are so real and so terrifying. Now, these are the kind of intrusive
if adults
thoughts.
have a nightmare, I still have nightmares sometimes. These nightmares are terrifying. And now imagine being awake and having these thoughts.
Oh, exactly.
And then for a child, that must be awful.
For a child, it is awful. It's not even a nightmare. It's not even, an adult couldn't even deal with it, to be honest. And an innocent child have to deal with these kind of things, and children are dealing with them, and they're hiding them because these thoughts are so distressing. They think there's something very wrong with them. Now, for a child like that, in this case, it was an 11-year-old who had intrusive thoughts many, many days in a row, and they were so upsetting that she would just cry and cry and cry and cry and think there was something wrong with her. They basically went away, or became like once, maybe 4 times a year, she'd have one thought. That is huge. Can you imagine the change in the quality of life for the child and for the closest caregivers for that? I mean, it's huge. It's huge. This torment, literal torment, is being relieved. And similarly, if you look at Dr. Shabani Sethi's study on schizophrenics, you'll see that in many cases the psychoses disappeared. Hallucinations, delusions disappeared. I mean, that's huge. It's huge, Roxana. And then, if we touch on anxiety. So in my case study with this little girl, her anxiety didn't go away completely. She wasn't on a very, very, very strict ketogenic diet. She was on a one of the more moderate, still I suppose for the layperson would be considered strict, but when it comes to therapeutic diets, it would be one of the more relaxed versions. So she was in nutritional ketosis, but only just. So you say nutritional ketosis is when you have levels of the ketone beta hydroxybutyrate that's above 0.5, and hers was 0.6. So just above the nutritional ketosis level, but consistently above it. So consistently in nutritional ketosis. Her anxiety didn't disappear completely after 3 months, but it was very clinically reduced. So that meant that the thoughts of, for example, suicidal ideation that this little girl had been having or wishing to die since the age of 4, those went away. She no longer even
But
remembered.
it's just 3 months. I mean,
just 3
if you
months.
think of a lifetime of having these thoughts, and then in 3 months, they're almost,
the thoughts
not
are gone.
completely, but almost gone. That's amazing.
So you have a child sobbing in your arms as the primary caregiver about these traumatic thoughts and then wishing to stop living. A little child, right? This started at the age of 4 in this case. And those thoughts went away. That's huge. That's huge. And then the anxiety also. So the compulsions also reduced dramatically. Yes, they were still there. The excessive hand washing was still there, but not to the point where the wrists were becoming raw from hand washing. Not to the point where the child would go back multiple times to check if the tap really was off. Many of the more severe compulsions associated with anxious thoughts were gone. So yes, she still had compulsions. She still had compulsive behaviors. It was still counting in her head when she brushed her teeth, or still counting when washing her hands. But it wasn't like she went beyond the counting to cause raw skin, or you know what I mean. So yes, it wasn't cured after 3 months, but it was clinically significantly better, so that the everyday functioning was so much improved. And then the feelings of anxiety in general, the difficulty falling asleep, crying to go to sleep every night, those kind of things, improved. And so many people are living with this. So many families are living with tormented and traumatized children with mental health issues, and the mental health issues are getting younger and younger and younger in our society, similar to the other metabolic health conditions: obesity, diabetes, insulin resistance. They're all getting younger and younger and younger, aren't they? Fatty liver, yeah, getting younger. I
imagine
and younger.
that with children, it is very important that you notice progress, so that you actually track progress. How do parents best track progress?
Yeah, so that's also really important. Progress is very difficult to track because most validated tools are to be administered very far apart, generally. Or if they
you don't want to ask your kid, like, oh, do you feel suicidal today?
Yeah,
like, oh,
exactly.
No, I didn't, but now I do.
Well, that's what happened. That's exactly what happened in this case. So in this case, questions about intrusive thoughts elicit intrusive thoughts. So we tried a validated screening tool for anxiety in this child, and whenever she was asked about intrusive thoughts, she got an intrusive thought. So the mother said, no, she's not doing this screening tool often. So we decided that we would do it at the beginning of the intervention and at the end of the intervention, rather. But then what if you get a bad day at the start of the intervention and a good day at the end of the intervention? Then it's going to look like the intervention's working, but it might just be a bad or a good day. Or swap it around. What if you get a really bad day at the end of the intervention? So the child has had a terrible day, right? Terrible day. All the things they hate have happened. And whether they're on a ketogenic diet or not, that's going to be a rubbish day. They're going to feel rubbish, and they're going to look a lot more anxious on that day, even if the ketogenic diet's working. And what if the first score was done 3 months previously when they were generally really anxious, but they'd had a wonderful day? So on that day, the score looks good. It's not going to show you the real change over time. And so that's really important, that we find a way to monitor the real change over time. And that's where I'm a big advocate for daily screening scores that are done quietly by the primary caregiver or primary caregivers. So look at the child. What are the things, and you can do this with your healthcare provider, but what are the things that your child struggles with? What is your aim with doing this ketogenic diet, or any treatment modality? Really, you should use this scoring. So if they're going onto a medication, also do it. What are their things? Okay, so in this case, it was a daily anxiety score, which is actually, it was a combination of a score for a daytime anxiety and a nighttime anxiety, because nighttime anxiety was often worse. So in this case, you take an anxiety score, then there was an OCD score, And in this case, the OCD score was broken into 2 parts as well. It was broken into safety behaviors and compulsive behaviors, because those were the way that the OCD exhibited itself. So, the mother would watch and see how much of the hand washing is happening, how many compulsive questions are happening to make her feel better, those kind of things. And then at the end of the day, she'd write down a score for that day, a Likert score. So 4 would be bad, 3 would be bad, and 0 would be no problems, right? And then
so it's observing the child instead of asking the child a question.
Yes, and doing it daily, and doing it in a bespoke way where you have highlighted what that child's issues are that you're trying to address. What are her biggest functional pathological impairments? Is it anxiety? Is it depression? Is it suicidal ideation? Is it intrusive thoughts? If she even tells you about those, or he even tells you about those, what are things that you can observe and note down every day? And then you will see a lot of noise in those daily scores. A lot of noise, because some days are going to be better than other days, whether you're on a ketogenic diet or not. And so you need to then average those to weekly scores or even monthly scores over time, and then watch the trend. That is really, really, really important. And anyone can do it for any intervention, whether it's a ketogenic diet or whether it's a medication, So I highly recommend doing that. And Roxanne, I realized I only said the one problem, which was, you said, what are the challenges for doing this kind of thing in kids? I said, it's these like parents or birthday parties or things, but I never actually went into what to do about it. So just what to do about it really is difficult, but it takes buy-in, it takes education, and most importantly, to get the buy-in from the people who are looking after the child most of the time, so that they can advocate at the school.
Yes.
And if it means getting prescription letters from the dietitian or from the doctor to send to the school to say this child may not eat this lunch, and it has, he or she has to bring in her own lunch, then so be it. If it's at birthday parties, then it's calling before the birthday party and finding out what foods are going to be on offer, and then sending your child keto versions of those foods to the birthday party. Or, it's thinking like that. It's also when the child goes to the grandparents or to the nanny or whatever, making sure that those foods are available, making sure the person knows what's going on, trying to get buy-in from people. I think I just wanted to say that there are ways to get around those things, but those are kind of ways. And those aren't the only things. Children with major problems, like on the spectrum, often have very limited palates. They will only eat, let's say, beige food, then what are you going to do? So in those kind of cases, you've got to work closely with a dietitian who's knowledgeable in a ketogenic diet and can help kind of work out a nutritionally complete diet, and supplementation may be required in those kind of kids, and then if the child is going on a very strict ketogenic diet, which would be used often for many epilepsy cases, then you often have to, again, work with a professional who can help you with supplementation, because there might be nutritional deficiencies. Children are fussy. Even children who haven't got issues are fussy. They don't want to eat liver and drink bone broth necessarily, So you've got to kind of say, okay, I mean, most kids don't even like broccoli, right? But if you're on an animal-based diet, there's going to be lots of things the child maybe won't eat. And how do you get around that? And if you are limiting protein, as it happens in some ketogenic diets, how are you going to ensure that the nutrients that generally co-occur with protein are sufficient? And that's where you need to work with someone who's knowledgeable. And also, I do recommend working with a coach as well. Once you've got that prescription and that help to get the nutritionally formulated diet for treatment, then work with a coach to hold your hand and to troubleshoot along the way, because sustainability, making something sustainable is largely about troubleshooting along the way, support and hand holding. If you feel you're all alone, you're far more likely to fail. So it's really important to surround yourself with support. Yeah, so that was the end of my comments on that question, which I forgot to answer.
Yeah, I from my own experience, having kids in school, and like one of them had or has type 1 diabetes, I find that schools are very helpful. Actually, they get all the teachers together, and then we work on a plan. Like, how are we going to implement that? How are we going to make sure that for birthday parties there's going to be special snacks available? Obviously, as a parent, I have to provide that. And that means the parent in general has to be on board. Do you find it difficult to get parents on board?
So if the parent's not on board, it's not going to happen. It's just not going to happen.
Yeah.
So I think, you can only suggest, I think generally the parents that come to me are the parents who already want this. So it's not difficult for me to get parents on board. But
Right.
in this case, with the case that I presented, the mother and the father of the child were divorced. So when the child visited the father, which was only twice a month, they weren't
Yes.
on board. So how do you deal with that then? And then it was a grudge thing where basically it was like, oh, your mother's this and your mother's that, and she's being ridiculous. You should just eat pizza and cake with the rest of us. And then the child has to watch the cousins and watch the grandparents, watch the dad eating the stuff that they can't have because their mothers said no, and then they get resentful towards the mother. So there's that kind of thing that needs to be dealt with. But in this case, it was twice a month and it was grudgingly done, and then the fallout had to be handled. But if the primary caregiver isn't on board, it's just not going to happen. I mean, you can try and educate, and people will come around if they're desperate enough, and that's where often the primary caregiver is desperate. If medications haven't worked, they've often tried so many other things, and then you can show them the rising evidence in adults and in epileptic children, which is where the evidence is, and then the mechanistic studies which show that ketogenic diet helps with those 6 metabolic underlying things that are there for everybody with mental health conditions. And then you say, well, and this is working in people, so would you like to try it? It's got, basically no risks if it's done properly. Let's try it. And often then the parent, because they've gotten to that point, will say, absolutely, let's try it. And they have to buy into it because it is a lot of effort, Roxana. It's so much more effort than pulling out the Kellogg's cornflakes and pouring in the low-fat milk, or pulling out the biscuits or making a sandwich with
The
sugary peanut butter.
Cheerios.
Exactly. I mean, that's much easier, right? Yeah, and I definitely find that people who eat this way, they've chosen that effort and they realize it's worth it. But for many people, it's really tough. And you think of mothers who are dealing with a mental health case on their hands. It's bad enough. It's exhausting enough being a parent, right? Trying to handle school and homework and the mayhem that exists in every parent's house and work and maintaining special relationships. Like a parent, especially a mother, I think is often so overwhelmed, even with a child without issues. A child with issues, now you're adding in everything being cooked from scratch. It's quite a thing to get around, which is another reason why support is so important. Joining groups, whether that's on Facebook or whether it's on, a support group that you find online, looking at ketogenic diets, or, it's really, really important because it's not easy. But once you get to grips with it and it becomes a lifestyle, you realize it's not as hard as you thought it was.
It's not only not as hard as you thought it would. You think you go in this and there's so much planning you have to do. But then as a result, and this is where I think the tracking comes in like perfectly, you all of a sudden see, okay, now this goes smooth. I don't have troubles here. All like my child is feeling better. It's in the end, actually you save time because you don't have to worry and deal with all that behavior all the time.
Exactly. That's
That might be another,
true.
really benefit of tracking, just to see, okay, this is working and this is worth it.
Yeah. But then it's very important that every week you go and average those scores, because if you're just looking at the daily scores, you won't be able to make out the wood for the trees because it's so confusing. There's so much daily variation.
You want to see a trend.
Yeah,
you don't want to see
absolutely.
that one bump and then be discouraged.
Yeah, exactly.
So
and you also want to track your diet as well, Roxana, and this is another thing where I think it's most important in the beginning, because there are lots of apps that can help, but the parent who's in charge, or the parents who are in charge, or the caregivers who are in charge, you need to make sure you're actually feeding your child what is really a ketogenic diet. So you can do that by testing blood ketones through a finger prick, but you also should be doing it by logging on, whether it's Chronometer or MyFitnessPal or Fat Secret or one of these apps. Log exactly what your child eats and do it for at least a week, at least. In this case, it was done for the full 3 months, but it can get exhausting. So do it for at least a week, or until you get consistent blood ketone levels that are within the range you're looking for. And then you can just carry on because you know it's working. So I think that's really important to track as well.
Yeah, that, and also if you continue tracking, and I'm a nerd for data. I tracked for a complete year. You can see I'm eating this food, and all of a sudden my ketones like dip and are
Yeah.
non-existent, and I could correlate that to a certain food that I ate. In that case, it was cream of coconut instead of coconut cream. And you wouldn't
Oh,
think there's much
wow.
difference, but like one is full of sugar and the other isn't.
My
So
gosh.
it can help you also isolate problems within
But
the food
Roxana,
that you choose.
doesn't that highlight how these foods can be really sneaky? So you think you're having coconut cream because it's called cream of coconut, but they're being very
Mm.
sneaky by making, it's not coconut, it's not pure coconut cream. And that's where it's important to learn to also, parents are going to have to learn to read labels. If they're going to be
Yeah.
sending these keto treats with to birthday parties, which I actually am generally, Roxana, you will know, not an advocate of processed keto foods or any processed food. But in the case of children, I have more of a place for it when it comes to things like birthday parties or these occasional treat days, because otherwise the child just can't go because they feel so left out. But then you
Yeah.
have to get to know how to read labels, because some of, for example, the sugar alcohols or the polyols that are used to sweeten these keto foods, they actually spike blood sugar really, really high. So, like if you think
Maltitol.
of, maltitol, sorbitol, they really spike blood glucose, and they're like, I call them a half sugar, because they contain half
Mm-hmm.
the calories of sugar and they spike your blood sugar about half as well. So it's still a sugar. It's not a low carb food, really. But depending on where you live, it doesn't have to necessarily be listed on the label or on the nutritional information table as a carb. It's
Oh.
basically seen as an empty, as contributing nothing to carbs in some places. And so you won't even spot it on the table. So you have to look in the ingredient lists for them. So you have to get to kind of know which sweeteners are okay. And really, when it comes to that, it's probably, when it comes to blood sugar, it's probably going to be monk fruit, stevia, allulose, and xylitol. And again, I wouldn't be having those every day. But for
Yeah, and you can
special
also
birthday
make
parties,
your own treats. And these own
yes.
treats, you completely control what's in them. My favorite go-to sweetener right now is allulose. But it could be monk fruit, pure
Yeah,
monk fruit, not the one stretched with erythritol. I wanted
yeah.
to touch on the research that you do in the writing. You co-authored Ketogenic, the Science of
Yes,
Therapeutic Carbohydrate Restriction in Human
this
Health.
book. Yeah,
That book. And maybe turn it to the side, because it's like a huge book. It is a textbook. It's like,
yeah.
it's very thick. Yeah, it's very thick. It's finely printed. There's a lot of information in there. How would you say this book has helped healthcare professionals and everyday people understand the power of TCR? That's therapeutic carbohydrate restriction.
Well, I think it's so essential. It's the first textbook on the topic, and it covers not everything. I wish it could cover more, but then it would be even a bigger tome. But this
That's
first
right.
edition covers most of the most important and most evidence-based applications for therapeutic carbohydrate restriction, written by the best of the best in the fields. Whether, that's epilepsy or Alzheimer's or depression and anxiety, or um, whether it's diabetes, type 1, type 2 diabetes, or deprescribing medication, or how to promote sustainable behavioral change, or whether it's how to devise or formulate this diet. It's got everything. And it tells clinicians or coaches or allied healthcare professionals about how it works, but then it also tells you how to implement it, which I think is really, really important. So practical
That
tips.
is the
So
important part.
exactly. So if you have a patient or client in front of you who has a condition, or they're coming in, you can quickly turn to the chapter, read through it, refresh your memory on that condition and how keto or therapeutic carbohydrate restriction works for it, and how the actual practical implementation looks. Because remember, practical implementation of ketogenic diet will differ depending on the condition. For something like mental health, neurological health, or cancer, you're going to have to be very strict. and very prescriptive with the diet. But with something like type 2 diabetes, you don't necessarily have to always achieve very high ketone levels to achieve a therapeutic benefit. Often it is better to be more carb restricted, but some people, as long as they're eating even 50, 60 grams of carbs a day, it's been shown that they can control their type 2 diabetes. Remember, that's total carbs, so it includes fiber, which doesn't have very much of a glycemic response. But my point is that for weight loss, you could maybe get away with a little bit of a higher carb intake than you would if you're trying to treat your glioblastoma in your brain, So it's different carb levels, different ways that the diet can look, depending on what you're trying to achieve. If you're trying to treat autoimmune conditions, you might go to a more carnivore-based diet, Whereas if you're trying to treat cancer, that's still very contentious because of the concerns around cancer and the mTOR growth pathway. So, the different ways that the ketogenic diet can be applied is really important and is laid out in this book as well. So you have the conditions, you have the practical applications, and then it even dives into the psychology and the clinical practice kind of guidelines, the nuts and bolts of how a patient or client does this. Amazing. I think we have like 67 authors. This is a Nutrition Network organized book. So most of the editors are like myself from Nutrition Network. Prof. Noakes is one of the editors. But it's really, really an amazing book, and I highly, highly recommend it. So at Nutrition Network, which is the company that I work for, I'm a lecturer there. I'm also the Senior Editorial Manager there, so I deal a lot with the content and the course development. And we were creating courses initially for doctors. We wanted to train doctors in how to use therapeutic carbohydrate restriction or ketogenic diets in a therapeutic way to treat conditions. And then allied healthcare professionals also needed it. So we started to train dietitians and psychologists and nurses. And then we realized coaches are so important. Yes. And so thank goodness we started training coaches, which is now actually our biggest base, because everyone needs a coach. You can get the prescription from the healthcare professional, but who is going to help you do it? The coach, right?
I want to interject there that the coaches or the courses you offer, when you have a certain amount of courses and a few you have to take, a few are a choice, then you get to be a metabolic health practitioner. So I, as a coach, am now a metabolic health practitioner and also a nutrition network coach practitioner. That enables me to know the science and the tools how to help others achieve better metabolic health.
Exactly. And then people know they can trust you if you have those qualifications as well. So that's why we developed the textbook, because we had all these trainings, right? But we needed...
the textbook is a textbook. It does not only include all the facts, but it also includes all the references. So this is science-based. It's not just like an essay, this is our hypothesis and this should work. No, it has all the science behind it.
Look at all those references. I don't know with the light, I don't know if you can see it, but there are pages and pages and pages of references. And they have all been fact-checked fastidiously so that people can go and for every statement, go and check, where does the statement come from? What was the author thinking? What is the evidence for it?
Some of the courses you develop were metabolism and the mind and resilience, mental health and stress management.
Yeah.
How do you think these courses help other healthcare providers and coaches to better help their clients or patients?
So when it comes to mental health or the area of metabolic psychiatry, which is what we've kind of focused our chat about today, Roxana, if people want to go and learn about it, then they should do the Nutrition Network's metabolism and the mind training, because everything that we know has been outlined as comprehensively and short as possible, with practical applications of how to implement it for your clients or for yourself. So Metabolism in the Mind is an amazing course for anyone who wants to learn about this amazing burgeoning field of mental health and metabolism. And resilience and stress also helps to deal with not necessarily the clinical mental health conditions, the pathological mental health conditions, but more to deal with day-to-day stress. and resilience, which unsurprisingly, I suppose, a ketogenic diet helps with as well, because even if you haven't reached pathological levels of mental health conditions, many of us, we all experience anxiety, we all experience depression, we all experience stress, which has very negative effects on our metabolism and can eventually lead to to mental health conditions. And so we need to constantly be looking at ways to deal with stress, resilience, and promoting mental health to help us deal with stress and resilience, so that we don't end up with these mental health conditions. So definitely those two courses are amazing, but we also offer, courses on other things. We're just about to launch one on exercise. And this is not a sports nutrition course, Roxana, this time. This is an exercise for the average Joe Soap that you see course. So this is who's in front of you. Wow, what should they be doing? Should they be walking? Should they be weightlifting? Should they be running marathons? How do you determine what they should be doing? How do you get them to do it? How do you figure out whether they should be doing push-ups or if that's going to be bad for them? How do it's a wonderful, practical, very, very practical course on also mind-body interactions and how to help the person in front of you get active. Because yes, diet is really, 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 really important, as we've been talking about, but humans are made to move. We're made to move. We're not made to be sedentary. Like I always think of that film, that children's film, Wall-E. I don't know if you've watched it, Roxana,
Oh, yeah.
but where the humans end up...
Obviously, with my children.
Yes. Yes, exactly. They all end up in these wheelchairs, right? Because they're just morbidly obese, and they don't need to move anymore because they just have these processed foods and they watch stuff on TV, and that's all they need. And I always think to myself, that's where we're going if we don't sit up, eat properly, and move. Move.
And the thing is, most people don't know. There's this saying, sitting is the new smoking. And I thought, no, that's far out. But it's actually true, because we are made to move. And when we move, certain enzymatic processes in the body are activated.
And endorphins in the brain.
Those two. But when we don't move, these processes are not activated. And them not being activated then can cause metabolic problems and disease.
Absolutely.
Autoimmune, all these things. So yes, exercise it's not about like running marathons. It's about moving. It's about lifting things, functional movements.
Functional movements.
That sort of
very good. Roxana, I always think these days in kind of an evolutionary perspective or an ancestral health perspective. And I think that helps guide me. So when I'm not sure about something, I ask myself, is this what humans were designed to do? And then you think back to like the hunter-gatherer humans, right? And you think to yourself, okay, were they eating this Big Mac? Were they drinking this Coke? And then the answer is pretty clear. Okay,
high fructose corn syrup.
Yeah, exactly. Were they doing that? No. What were they eating? Okay, then I should probably be eating more like that, right? Because that's what the majority of our genetic evolution taught our bodies to eat. Is to eat
Were
like
they
that.
sitting in recliners and watching TV and scrolling through social media all day?
Exactly, and that's where it brings us to sitting as the new smoking, as you said. We can't just think of food. We can't stop there. We need to think of the general lifestyle. Were we living in small communities and connecting with each other? Were we sitting in front of the TV or social media or scrolling the whole day? No. Were we seeing the sunlight? Yes. Were we lifting things and helping with things and moving? Yes. Those things are generally, if you just think of it in that framework, an ancestral health framework, what are we supposed to be doing? Are we supposed to be swimming in bodies of water like lagoons or rivers or the ocean, and what impact does that have on our microbiome? It's been shown to be really important for the microbiome, contact with nature, getting those microbes in our bodies just naturally. So there's all these things we don't even think of, and we cannot even
maybe
think of them.
dipping into cold bodies of water to kind of like put a little stress on the body and not be comfortable 24/7.
Exactly. That comfort thing is a big thing. Us humans, we are so comfortable these days, and we wouldn't have been comfortable. And does that mean that we are now saying that everyone must go and live outside in a tent? No, we're not saying that, but we are saying put your body under hormetic stress every now and then, like do a cold dip every now and then. Push yourself a little bit with exercise every now and then. Yeah. So I think it's important. It's important to think ancestrally, what are we supposed to be doing, and use that as a guide if you don't know the answer. Then it makes everything much more simple.
What I see at the conferences like Low Carb San Diego, I meet all the other metabolic health practitioners. I meet doctors that went through your training, and I see them going out in the world and healing their patients. Because in the current medical system, it's more about treating and controlling symptoms, not so much healing them or treating the root cause. These courses that you do, when people are interested, where would they sign up?
So you just have to go to nutritionnetwork.org. That's www.nutrition-network.org. And on there, you can follow the tabs and you will quite easily be able to find our courses. You can sign up as a member there as well, which will give you access to our exclusive membership platform, where you get to interact with other Nutrition Network practitioners, metabolic health practitioners, and just Nutrition Network members. So these are doctors, coaches, nurses, dietitians, psychologists, lay people coming together and asking their questions, saying, I have a patient like this. What would you do? Or what is your opinion about the reduction in thyroid hormone that you might see on a ketogenic diet? Or have you seen this latest paper? Let's chat about it. Or, there's master classes available. There are journal clubs available on there. So it's a lot of exclusive content that allows for people who feel siloed or unsupported to be supported and to get information. So you can sign up for that there. You can sign up for the courses there. You can contact us at Nutrition Network as well. You'll find our email there. And then you'll also find us on social media as well. So just look for Nutrition Network, whether it is on Facebook or whether it is on Instagram, we're there. So so absolutely find us, go to our website, and from there everything should be clear.
I did a lot of your training and I find it incredibly helpful. Also the handouts that I can use with my clients with the green, orange, and yet red food lists. And it even goes down to legal, not legal advice in the sense of, but what to think about in terms of legal things when you give nutrition advice.
Yes, well, that's really, really important. And we're launching an update of our ethics course as well this year still, I think. So everyone should watch the space for that, because we have advocate Joan Adams talking there. We have questions about the ethics around animal-based diets on there. We have ethics around treating cancer on there. So all the contentious things that you can think about coming out, because ethics is really, really important. We have to act ethically. First, do no harm. Then be effective in your treatment. And, we've got to think about things like the planet. We've got to think about things like religions and cultural norms, and what's okay for certain people might not be okay for others. We can't all say, well, this is how humans are supposed to eat, so everyone must eat that way. That's not, it's not being culturally sensitive, and those kind of issues are important. And so we cover that in our...
does not work for every culture.
Exactly. It doesn't work for everyone. And as our Indian practitioners have shown, you can actually work around like a beef-free diet or a more vegetarian diet. Yes, many of us would say that's not ideal, but does every diet have to be ideal, or does it just have to be better? Do you have to promote the optimal health that's possible within the person's cultural structure? So those kind of things are really important. We need to be talking about them, and that's why we're updating our ethics course. And so please, anyone who wants to learn more about that, you'll be able to get ethics points for your CPD points or CEUs or whatever you call them in your country, which is also really helpful, because I know that here in South Africa, where I am, we need a certain number of ethics points every year to remain registered with our health body as well. So it's important for that reason, but it's also important for the content itself,
Awesome. Tamzyn, it's always such a pleasure to talk with you. Thank you for sharing your insights. Before we wrap this up, is there anything we missed? Anything else you wanted to share with the viewers?
I don't think so, Roxanne. I think we've had such a wonderful discussion. I mean, there's so many things to talk about. I could chat to you and your audience about gut health or about cancer or about any of the applications.
Yes.
But I think I'm really looking forward to chat more when I present this case at the Kick Sugar Summit. So that's going to be really exciting. So anyone who wants to hear more details about this case, I'll be going into more details there. What exactly did the patient eat? What does it look like, for a child? All sorts of things like that. So please come listen to that at the Kick Sugar Summit. And if you want to be trained in this area, come to Nutrition Network, find us, and there will be a training for you. Thank you. Thank you for having me.
I endorse the training.
Thank you
so much for joining us. Bye-bye.
Bye-bye. Thank you.